Hi friends, now we are going to watch the video, and I'm going to demonstrate how to use HIV rapid test kit. This is a HIV rapid test kit from Microsidd. This is the pack. This is the third generation kit, and what is available in the kit, let me show you. So initially, this is the HIV card, which will be in a foil. Then next we'll be having a dropper, a user manual, how to use it. This is the entire manual, how to use it, right? I will show you one by one. There will be a pricking lancet, which is provided in the pack. A swab, alcohol swab, it is also provided, and a buffer liquid. Alright, so first thing you have to ensure all these things are available with you. Okay, you can go with step by step, no need to get panic. Nothing is going to damage any of the procedure, right? Go step by step and just do it. And here I'm going to start with the foil first. So this is the foil. I shall open the foil. This is how it gets opened, and here is the card. So this is the card, and let me give you some more idea on the card, how it works, and what is the specification of this. This is the cassette made of the plastic, medical grade plastic, and this is the membrane, and this is also the membrane. This is the sample well, this is the test band area, right? So whatever the samples and buffer we put in the cassette, that has to be done here, and here it will give the bands. How the bands will come? It will come like this. These are the bands. So here you can see this is a single band, which means the test is negative and test has gone proper. So this card will be having accuracy of 99.8%, and as per NIV it has been certified, and below that nothing can be done. So accuracy is most important in any of the card. So don't go with any of altu-faltu brand which they provided the cheaper prices. They may not work properly, and there is no guarantee over there. So here I'm using to prick and get the sample from glucometer pen. If you have a glucometer pen, that is fine, else you can prick directly, right? So now I'm going to start exactly. Got it? So let me start with, because I'm very much comfortable with the glucometer pen, I will do it with the glucometer pen itself. So first thing is I have to prick. So before pricking, please wash your hands properly, so that there is no any kind of dust is settled on your hands. So once it is clear, so that should be all right. So hygiene has to be maintained, right? So let me start with the prick. Firstly, push the entire finger so that blood flow will happen in a proper way. It will be flowing properly, right? So now it is flowing. So ensure the blood is clear, and while pricking from this, the pain is very less, lesser than a mosquito bite. Even mosquito bite will be having some some anxiety pain, but here it will be not. Okay, so here I have pricked, the proper drop has come out. So right now I should drop this. I'm very much comfortable with this and it is fine for me. So I can take this. Alright. So now the membrane, you have to drop exactly in the membrane. Alright. So now you can see the drop has been done exactly on the membrane. Right, and now you will find another bottle. This is the buffer solution, the buffer liquid what you have. So no need to get panic if it spills or if you touch that membrane. You may think you may get infected. No, nothing is going to happen. These are just the reagents. So by the reagent there is no contamination. Right, so we have put 2 drops of sample right now. So this is blood stain which has happened. So let me wash it with the wipe with the alcohol swab which is provided with this. Why we prefer alcohol swab is just to ensure the area of the prick is clean and any kind of bacteria or virus are dead. Right, you know better how alcohol kills the bacteria and viruses. Right, so clean. Right, and now you can see the reagents are working, the reaction is happening. Okay, so let us leave it for a few minutes. So this was tested earlier 15 minutes ago in my another video which was in Hindi. So here you can see the clear band. Right, so here this is the band which has worked out very clear. This is negative. Right, the control band appears means the test has gone perfectly and it is as per the requirement and accurate. And now it is, the band is maroon color. Right, so this maroon color will come after 15 minutes of the test. So, and again no need to see this after 20 minutes. So whatever result you get from the 10th minute to the 15th minute, that is the proper, perfect, accurate result. Right, so let us see what has happened to our the test which has run. Yes, you can see the reaction has been done and control band has come up. Right, so this is the negative, but it is in the initial stage. So we have to leave it for some time, and after some time we'll find this. Right, this will be the band. So this is how you have to perform the HIV test. And again, when it comes to the clarity, so here instruction manual has been provided to you with the kit, how to use it, go through it, and these are the simple steps. 1, 2, 3, only 3 steps. Just take the card, prick it, put the sample, next the reagent, wait. That's it.